if you think about Africa, you probably think about desert, you think about the jungle, you maybe think about this mud housing that you sometimes see on TV and National Geographic. You probably don't think about an advanced emergency care system. And that's why I'm here with Saul, because the first time I came here was pretty surprised what you built up here. So let's talk about it. Today is Friday evening. It's the 28th of February. So today is payday. What would you expect today for calls?
So from an EMS perspective, South Africa is generally a more trauma-focused environment, which has given our paramedics and doctors and anyone in the pre-hospital and first point of care on arrival at hospitals exposure to a vast amount of trauma and everything from car accidents and severe rollover accidents, high impact, to gunshot wounds and severe assaults, which leads obviously to all the different head injuries and polytrauma and everything like that. So I guess towards payday weekend, everyone has a bit more money in their accounts, which predisposes them to environments that are trauma related or potentially trauma related. And we usually see an increase in volume around from about the 20th, 25th of the month all the way through until the 1st, 2nd of the month, from a volumes perspective within the pre-hospital space.
Okay, yeah, great weather today, so everyone will be on the streets.
Exactly.
And with that, welcome to South Africa, welcome to Johannesburg, and to our podcast, The Safety Huddle, today with Saul from MediResponse. So, Saul, we heard a little bit about your scope of work, but if you might introduce yourself and MediResponse a little bit more.
Sure. So I'm currently the Chief Executive Officer of MediResponse and our group of companies. I am a RCU trained paramedic by trade, but more desk bound, unfortunately, as the years have progressed. So, yeah, I manage a pre-hospital emergency services team, as well as a number of other service verticals, which we'll get into in a little bit, that I can give you some background on, and yeah, we can go into that.
Sounds great. So how did you start your career? Are you a paramedic as well, or what was your very first job in your life?
So I actually started in the sound engineering world.
Okay.
Found that wasn't really for me, but as I got involved with the pre-hospital fire and rescue space at the local fire department, my love and passion for emergency services grew. And I progressed through the different qualifications in the South African context, right from a basic ambulance assistant working on an ambulance all the way up to aeromedical RCU patient movements, which is very much comparable to, if not, I'm going to say this in my world, a little bit is leading the way in terms of how the international standards are being driven. So South Africa really has a progressive way of engaging in the pre-hospital fire and rescue space, and we really are driving hands-on involvement in our world.
Okay. So MediResponse is not only doing ambulance services,
Correct,
but also fire services, and what else do MediResponse do?
So MediResponse, as I like to tell our clients, is a pre-hospital solutions provider to our client base.
Nice.
We offer a very broad menu type approach. We specialize in on-site medical solutions in the industrial oil, gas, mining space. We run a fully fledged training center for our clients and focus very much on the compliance side of workspace environments, occupational health, first aid, basic fire awareness. We have a very big events, medical services and on-site department that focuses on everything from F1 racing in the city center of Sandton to corporate events and functions at VIP clients. We run a 24-hour global coordination center. We have a telemedicine and topside support system that we give our clients internationally. And the rollover of all of our aspects all are tied in through our coordination center. So we've got a central hub of communication that we have built to ensure that our paramedics, doctors, nurses, clients all have a central point of communication, and then we farm that out to our management and operations team to keep on top of. I'm just trying to think. I went through our remote site and on-site solutions, our event medical solutions, our training and education system, our EMS services, and I think that's the broad overview of who we are as an organization. Obviously, tying into our global coordination center is our aeromedical services and our ICU teams that travel throughout Africa and the world, repatriating patients and families. So that ties into a global solution that we provide our clients and teams on the ground. Yeah, that's a pretty broad overview, definitely. So you already talked about events. I think that's how MediResponse started, right? With like event services. Yeah. So our founder Hadley started this organization which is a really cool story. We out of a garage. Oh, okay, cool. And this is a garage startup and has progressed over the years as an event medical services provider. And over the years has scaled into what we've built today. And the strong manpower that we have, the strong management team, the availability of resources from both aeromedical equipment and ICU equipment all the way down to the on-site clinic setups. We've really scaled over the years as an organization and become a trusted brand in the international market. Yeah, that's pretty cool. I hope that we can get a tour after that. Yes, definitely. We'll take a walk around the offices. Cool. Yeah, because right now we're in the MediResponse headquarters, and if you say it started from a garage, it's pretty impressive what you have here now. Sure. Let's talk a little bit more about the ambulance system or the first responder system you have here. There is like a big difference between private and governmental, right? Because we have this in Germany as well, or in Europe, that you have private and governmental, but I think here the difference is a little bit wider. Yeah. So South Africa has a very big split between private services and government services. Yeah. South Africa has gone through a major transition over the years of having to implement complementary services to the government services to ensure more people get access to pre-hospital medical care. We've come leaps and bounds from a service delivery perspective, and the complementary relationship between private and government has been able to, as I said, provide further reach and getting out to communities that would generally have to wait hours on end to get serviced and to get either assessed, treated, or transported to an appropriate facility. The private and government services are more and more working closer together to ensure that standards are set across the board. We've got a strict Department of Health, I'm going to use the word control and management of both private and government services to ensure that we meet international standards. Yeah. And that in itself ensures a set value across all pre-hospital providers that meet the Department of Health standards. And we pride ourselves as a pre-hospital provider that we are hand in hand working with as many quality providers to ensure that our patients on the ground get the service they deserve. Okay, yeah, very interesting. But that means that everyone gets help, right? It's not that you have to say on the call what insurance you have, you will be helped no matter what. So if we don't have resources available, we tap onto other networks and providers that may or may not have resources available. We've created a network of organizations as well as rely heavily on our government service to assist us in terms of transporting patients. What we've done is we've scaled our primary response to as many patients as possible. Even if we have to wait for an ambulance to arrive, we ensure that the patients get the highest level of care possible to ensure that they are well treated, and we treat everyone fairly across the pre-hospital space.
Yeah, what I also found impressive, because we drove at some hospitals, that you can also see the difference between governmental and private sector. So whoever will come here will also see this difference, which is quite huge, but you can also see that everyone will get treated in a certain way, right?
I think it's important to note that we as a pre-hospital system are trying to do everything in our power to look after the broader community. And there are stumbling blocks in a third world country, but that also allows for people to step in and really do good for the communities around us.
Okay, nice. Talking about communities, I think in South Africa you have like 9 official languages, right? Which already shows how many different tribes, how many different cultures are mixed together here. How is that working?
So from a MediResponse perspective, we try and employ as many different culturally diverse individuals to ensure that we have the ability to treat in the patient's own language, to ensure that our clients and our patients get treated with that diverse approach to patient care. Yes, we everything is done in English, but there's that emotional side to treating a patient, and we try and ensure that we are able to tap into that in every single patient engagement. And we do that by employing as many culturally diverse individuals we can, and build a culture of inclusivity in everything that we do as an organization.
Yeah, that's great, because I think it's not only the medical side, it's like you said, it's also a social side to it, the emotional side. Whenever someone gets hurt, we have been on a call where I think no one was really speaking English, so English was not their first language, so it was very difficult to engage with them, because no one was really bad hurt, but there was a lot of emotions involved, and 15 people around this patient, because they all have been friends. So also the cultural side is very interesting, how you deal with that.
Yeah, I think the South African environment is generally a welcoming environment. Our culture as a community is everyone wants to be involved and assisting, and it's our jobs as professionals in our world to draw those lines and ensure that our patients get the best care, but at the same time managing what's happening around them to ensure that everyone feels comfortable in the processes, especially in the high trauma environments. You have a patient who's lying and has a gunshot wound. The family is obviously incredibly concerned. You've got to manage a critical patient and a community, and if it's a community that either wants that person removed from the environment because they are potentially a suspect, or it's on the complete other side of it, where it's a community member that's been harmed by the violent society that they're part of and are incredibly emotional towards the scenario. So it's a fine balance between treating a critical patient, monitoring what's going on around us, and ensuring that we can get out of there with the patient to the most appropriate level hospital that is willing to accept that patient at the time of injury. So cultural environments are always very interesting to play in, and in South Africa, with all the cultures that you mentioned, it's an enjoyable place to treat patients.
Yeah, absolutely. Talking about violence, because that's the first question we get when we come here: is it safe? So what do you do that your staff is safe, and also if foreigners come in, how do you ensure that?
So it's interesting how the world portrays South Africa. We are a more, I'm going to say, rough around the edges in society, but at the same time, there are multiple first world environments that people live in, and we've put solutions in place to ensure that our staff are protected. All of our vehicles are tracked. All of our vehicles have camera systems involved. All of our staff have access to our global coordination center and are able to alert them if they feel unsafe. We've put protocols and procedures in place to ensure that, one, our staff are protected and feel comfortable to act to the best of their ability in the environments that they're going into. But at the same time, we're very cognizant of the safety of the global environment, and we would never put our staff in harm's way. If an environment is not safe for our paramedics or doctors to go into, we would always hold back and wait for the right authorities to ensure that those scenes are safe before we progress into them. Yeah. From a day-to-day environment, we've built the mechanisms and the systems to ensure that we're comfortable in how we live. And yes, we've got to be alert to what's going on around us. Yeah. But when everyone comes out here and sees that we're not this scary environment to live in, and people carry on with their day-to-day lives and enjoy the South African world. So that's what we do from a business perspective. But the culture or the general culture of inclusivity within the South African communities is not portrayed correctly in the international world. Yeah, absolutely. So I'm hoping that the more people that come out here can spread the word that we are one of the most enjoyable countries to visit with the most incredible diverse cultures, as well as really cool things to do and see and be a part of. Yeah.
No, I totally agree, because it's our third time now here in South Africa. And I found it interesting how much hospitality and hostility are here combined somehow. I've met the most nicest people, most friendly, most welcome people here. But of course, if you drive through the townships or the slums here, you see a lot of poverty. Like you mentioned, a lot of gunshot wounds. You don't really have that in Europe, right? Because no one really carries arms, and also the gang crime or the violence is not on a level like you have it here. But like you're saying, I also share this, so I found it very, very enjoyable here, and also the cultural diversity. Of course, you have it in Europe as well, but it's more homogene. It's not as
I think there's definitely a fine line between environments, and on the one side of the road, as you said, is an informal settlement where people unfortunately are living below the poverty line. Yes. And one road away, people are living in mansions that are millions and millions of dollars worth. Yeah. And it's clear as day, then you can see the differences. Yeah. But at the same time, it allows for, in our world, the ability to treat patients and people of different socioeconomic statuses. You've got to we could go and treat a patient in $1 million or $5 million house. Yes. On one call out, and straight after that we could be in the informal settlement treating the patient who's been assaulted with a bottle from a drunk environment. And the one is a cardiac incident of a CEO or somebody who has an anaphylactic response to a medication they've taken, and literally not even 500 meters away across the road, you're dealing with the assault at the lower LSM. Yeah. So it gives us the exposure and the ability to really gain experience as pre-hospital providers in both the international type environments as well as the lower socioeconomic environments, which I think is very different to a lot of either European, North American, or the Pacific environment types of practitioners in the international world. We really get a great cross exposure and a hands-on, I'm going to say, a little bit more lenient approach to how we practice medicine, although sticking within very strict frameworks that are governed by our Health Professions Council as well as the Department of Health. So it's from my perspective, one of the best environments to really get hands-on and see how we do things,
Yeah.
and explore those avenues.
Yeah, absolutely agree. So how are the paramedics here trained for this broad environment?
So a few years ago, we changed our training style. We used to have a lot of short courses that people could go through, from a basic ambulance assistant to an emergency assistant, an intermediate life support, and then an advanced life support. We have transitioned very quickly into the tertiary-based education mind frame as a pre-hospital industry. So in today's times, you can either do a diploma or a degree in pre-hospital emergency medical care and rescue. And we are very lucky to even have exposure to PhD and master's-based pre-hospitally trained individuals. So we've welcomed the world of research, and I have introduced research into the way we treat patients. So we've taken all the research papers that are being created worldwide, and we are really driving treating our patients via research-based protocols and guidelines in the way we're treating in the South African context. So if you take the lower LSM, the higher LSM type people, combined with the international standards of research, tied into our tertiary education, and those skill sets are world-renowned, and you find that South African paramedics and doctors are headhunted because of that now, I'm going to say that circle of quality that South Africans are coming out with in the pre-hospital space.
Yeah. Yeah, that's great, because you don't only have like the internationally recognized training, you also have the exposure to things that we might not have in Europe. So
correct. Yeah. So I mean, we treat gunshot patients and severely assaulted patients on a very regular basis, where I've engaged with colleagues internationally who see maybe a gunshot patient once in their career.
Yeah.
And that's why we are creating this, and to move into it, the acceptance of international people into the MediResponse world to come and see what we do and come and experience and get hands-on exposure to the South African emergency medical services and fire services.
Yeah, no, that's absolutely great, and we're very happy that we could experience what we experienced with you, and that's why we want to make it more accessible for people who come from Europe or the US, maybe also other African countries, because it's probably also very different among this continent. So what exactly can people like us expect if we come here to MediResponse?
So what we've put together is a package that gives international individuals exposure to our environments. We've put together a world where somebody would be picked up from the airport, that would come through to our head office with branded individuals. Obviously, we spoke about the safety aspect and the peace of mind, knowing that we've got the systems in place to ensure that whoever's arriving at the airports or into South Africa is being collected by a well-represented team, come through to our head office, where we've got rooms and catering and everything in one environment, that get exposure to our senior management team, our medical or pre-hospital emergency care practitioners who are advanced life support, and then they're put on the road and they're put onto our vehicles in an observer environment where they can see, feel, and get a taste of what the South African emergency services is. And that is then expanded out into the hospitals, and we go through and we see and we get the people who are coming through here exposed to what South Africa really is like, both in the private world and the government world, from a pre-hospital environment perspective.
Yeah, that's really great. So I hope that you enjoyed the podcast, and I hope that you join us here in South Africa one day. You can come for 1 week or 2 weeks, right?
Of course.
All you need is your flight. Like Saul said, everything else is sorted. You get picked up. You get the great hospitality of South Africa here, all inclusive. And yeah, thank you very much, Saul.
Yes.
I hope you can take us on the MediResponse headquarter tour now.
Pleasure.
So you will see this in the next video. And yeah, come join us here in South Africa, and I hope to see you guys soon. Bye-bye.
Cheers.